My name is Judy Rotich. I'm a Chief Public Health Officer working in Kisumu County in the Environmental Health Department unit. And here in environmental health, basically we do other aspects of WASH. I know you've heard WASH everywhere, but I know most of us, we don't know what WASH means. And maybe basically to define, WASH is water, and that is access to safe and drinking water. And then we have sanitation. This is access to basic hygiene and sanitation services. Sanitation, includes toilets, access to toilets and latrines, and not just latrines and toilets, but improved toilets and latrines within our communities. And then we have the hygiene bit, the hygiene aspect. And for hygiene here, we are talking about basic hygiene, that is bodily hygiene. For all of us, we must ensure that we maintain high standards of hygiene as a person. And then we have environmental hygiene. Here we ensure that the environment is clean and such things. There is no waste in the environment. And then we have other aspects of hygiene, which include hand washing and such. And I know for most of us, we ignore very important bits of hand washing. And I know that is very key because recently there was a study, a survey by WHO, and they went into our communities to try to find out how we observe basic hand hygiene practices. And I know for most of us, we assume that our hands are clean all the time. And I was observing, like for example, now when you are serving tea, I don't know how many of us washed our hands before taking the tea. That answer mnaweza jibu nyinyi wenyewe, but I know that is something that we totally ignore. And you can imagine if you assume your hands are clean here because you're in a very clean hotel. What of those of us who go to the toilet and then you just go out of the toilet and then you don't wash your hands? And you know that person atatoka kwa choo na kuja kusalimia, si ndio? So you see the very integral bit of us washing hands, because the person who greeted you don't know where they came from, si ndio? And I know for most men, mtu anatoka kwa choo. Sorry, and I'm not attacking men, but you see anatomically, si ndio daktari? You have to touch, si ndio? Ama ni hold. I don't know which is which. And you know, ukitoka kwa choo, most of them don't wash their hands, ndio? Na atatoka nje akusalimie. So for us, don't assume that your hands are clean because you greeted maybe daktari, you greeted a director, you greeted who. But it is very important for us to wash our hands. And then another bit of hygiene is the food hygiene. And I know some of us, this is something that we also assume and ignore, that because food is prepared in somebody's house, so and so, huwa wanakaa wasafi. And ama food kama iko prepared in such a nice hotel, the food is clean, si ndio? But that is not good for us to assume some of these things, because hygiene is very important, and it is good for us to observe hygiene at all times. So I just want to focus mostly on hand hygiene, because I know that one, so long as you wash your hands, I know you're probably safe. Not 100%, because some of us also use dirty water, sindio? We assume that because you just clean your water, the water is clean, but some of us use dirty water to clean our hands, which is not right. And the moment you use dirty water to clean your hands, automatically you're at risk of getting water-related or waterborne diseases. And these include diarrhea, which is a leading cause of morbidity and mortality for children and adults. So we know that. And then another thing, maybe on hygiene, you also have the built environment. I think for public health officers, most of us, I know we are used to public health officers walking around our communities, doing some inspections and all that. But you see, it is very important for them to do their work, allow them to do their work, and this work includes inspection of buildings and environment around us to ensure that they are all safe for human habitation. So within WASH and UHC, I think mostly we try to focus on the preventive bit, and there is ensure that there is access of basic hygiene services to prevent the spread of diseases. And then we have the preventive bit. Here is using WASH initiatives to create barriers between us and diseases. And the barriers, I think I've mentioned some of them, which include hand washing, access to basic hygiene services, and then the curative bit. I know essentially some people will fall sick, and if they fall sick, they need to access basic health services. And I think for WASH, I don't know if I should if I should add a little bit more. And then for WASH in UHC, we have to ensure that all these services, they should be available. I know for us, you know what universal health coverage is. the services should be accessible, they should be available, they should be affordable, and then they should be of quality. I know I might have forgotten some of the things, but this is what we should aspire to provide. And then for WASH, they were entrenched in the Millennium Development Goals. I know most of us have heard about Millennium Development Goals. Did we achieve them? Did we achieve them? Now they've moved to become Sustainable Development Goals, that is 2030. So we aspire to achieve Sustainable Development Goals by 2030, and no WASH is a very important Sustainable Development Goal, but also there is also the Agenda 2063, the African Agenda 2063, and still WASH is still an integral part of this. So we still have a long way to go. And for Kisumu County, we have approximately 1971 villages, 1,971 villages, and out of this, in the WASH aspect, the CLTS, we have community-led total sanitation, and I know most of us have heard about this. Is where we essentially try to make sure that people have latrines in the villages, and if you don't have one, you have access to a latrine, probably by using the neighbor's toilet, or you go to a school or something like that, so long as you have access to a latrine. Because if you are not using a latrine or a toilet, where are you going? And you see, out of 1971, 60% of these villages have been certified as ODF. ODF means they are open defecation free, meaning if you walk around those villages, you will not find anyone defecating in the open. But if only 60% have been certified open defecation free, that leaves around 40%, meaning 40% of our villages are OD. OD meaning there is open defecation. When you walk around those villages, you find open defecation, meaning there are a lot of people who don't have access to the toilets. And you know, for us, you assume because I have a toilet as a person, I am safe. But what of your neighbor who's going to the toilet in the bush? Are you safe? No, we are not safe. So I think for us as WASH, we have a very long way to go. And I'm happy some of the community member and the community health volunteer have mentioned some of the things we do in WASH to try and prevent diseases.